So starting with, I have a question for Tian about her presentation. So if the IVRT apparatus dosing amount and stirring rate used is per USP recommendation, do still need to provide rationale and data to support the selection? Tian, I appreciate if you can start Q&A session by answering this question.
Okay, so if the dosing amount and also the stirring rate is in accordance with the USP recommendation, I think you can just state that in your submission. And to me, I don't think further information is needed. I think that will be sufficient. And regarding apparatus, I hear that the USP is planning to removing a lot of the specifications regarding the apparatus, like dimensions and stuff. So to help the reviewer understand how you customize your USP, your apparatus, it may be helpful to provide some rationale if your the apparatus that you use is slightly different from what is currently being recommended in the USP.
Thank you, Tian.
Thank you.
So there are many questions about the dosing, how to minimize the shear rate when using the syringe for dosing of sample in IVRT study. There is one more question related to the same shear rate. How to estimate and present the shear force applied during sample dispensing through the syringe. I think we talked a lot about shear force and application of dosing previously. If anybody from panelists could able to answer or reiterate this question about dosing.
Sure, I can try to address. Thank you, Usha. So I think the challenge for us when we look at the applications is it's not so much that we want to reduce the shear forces during the application. It is more so that we would like to understand if the shear forces that your product is experiencing due to the syringe or whatever dosing mechanism you have selected to dose during an IVRT and IVRT study, for example, is changing the microstructure of the dosage form significantly, such that, say, for example, before when you dispense the product from its container closure system, a tube, there were some minor differences between the microstructure of the test and the reference product, but by extruding the product through the syringe, those microstructure differences kind of went away. And as a result, you don't see the impact of such differences in your IVRT study. So what we would like for the applicants to consider is when you select your dosing syringe or your pipette or whatever that may be, to take into consideration looking at the microstructure of your drug product, if the bore of that syringe or if the application technique may have an impact on the microstructure of the dispense product, and provide us with information related to, like, say, for example, the dimensions of the syringe, and also your thinking behind why you don't expect, with whatever the dosing mechanism you have optimized, it is not expected to impact the microstructure beyond whatever shear forces the product experienced during extrusion from its container closure system.